the St. Louis Public Schools are really preparing for a really robust and safe school year. I think, the things that we can do as a community and as a school community to protect our students include having high levels of vaccination in the community. I think there's a lot of encouragement for vaccinations for school personnel, and that's just an additional layer of protection we have this year that we didn't have last year for schools. Fortunately, we've had over a year worth of experience operating schools safely, and we've learned with a number of strategies in place we can really keep kids very safe in the school environment. And that includes things like screening students for symptoms of illness and keeping students home when they have any signs of illness, using face coverings, and that has been very effective in reducing transmission. Use some degree of physical distancing, somewhere around 3 to 6 feet, keeping kids in cohorts of students. And by doing all these strategies, including also then things like routine hand hygiene, we've been very successful in our ability to operate school and have had very little evidence of in-school transmission of the novel coronavirus. One thing we've learned through this pandemic is that students are very safe in the school environment. In fact, there have been a number of studies that have looked at kids who have tested positive or have had symptoms and have been tested for the novel coronavirus. And students who have been receiving in-person education in schools often are much less likely to test positive for the novel coronavirus. And that's because schools are very good at implementing the mitigation strategies that we know are very successful in preventing viral transmission. So, again, vaccination is one of the best strategies we have for reducing illness and the impact of the novel coronavirus. Fortunately, we have vaccine that's available now for students who are age 12 and up. And currently what we're seeing in our community and in our hospitals is really a pandemic of those who are unvaccinated. So the people that are primarily getting ill, the people who are ending up in the hospital, the people who are ending up in ICUs are largely those that are unvaccinated, particularly adults. And so again, one of the best strategies we have for our students and for our school community is to be vaccinated.